Today, I'll be demonstrating transverse abdominis exercise. This can assist with diastasis recti recovery, as well as those with back pain and hip pain. Now I'm going to show you transverse abdominis bracing. We're going to start laying down. Again, it's going to be easiest position. Okay, as you lay down, keep your knees bent. This is an exercise that people next to you probably will not know that you're doing this exercise. It's a very deep muscle, your transverse abdominis. It's like a corset that kind of runs in this direction, okay? And then it comes all the way to your spine and attaches to the spine. So this is your own corset. You want it to really strengthen it. What I want you to do is I want you to find the two pelvis bone, or usually people call it hip bone, right in front of you. If you put your hand on it, you can feel two pokey bones right here, okay? Place your hand on top of it with your fingers a little bit moving towards the center of your abdomen. I want you to imagine there's a line between the two bones right here, okay? What you're doing is that you're gently drawing the line to bring the two bones closer together. It's almost like a gentle sucking in motion, but you're not forcing that belly button to the spine movement or pelvic tilt. These are not the correct way to do transverse abdominal bracing. What you will feel, if you do it correctly, is as you're drawing the line, you will feel like your finger is gently being pulled inwards and towards your spine, just a little bit. And what you can feel is a gentle trampoline-like tension under your finger. And then you can release. A lot of time when you do transverse abdominis, you will feel your pelvic floor muscle also kind of tightening up a little bit. That's normal. They usually work together. So let's try that. You're going to gently pull in the line to bring the two bones closer together. And you're going to maintain your breathing and holding that contraction for 10 seconds. And then release. This is an exercise you want to do 10-second hold 10 times, at least 3 times a day. I'm going to show you a little trick to help you find this muscle. So if you try to do a long shh sound, it actually automatically activated the muscle. So let's try that. So you should feel when you make that she sound, it gently pull in that line of tension towards your belly button, midline of your body here. Make sure you're not doing it forcefully, shh, and then your belly actually get pushed out. If you're noticing when you're doing this exercise, your belly get pushed out, you're not doing it correctly. It should be a gentle tugging that makes your belly flat. Okay, let's try the she sound again. It's a light, gentle, long she sound. So you can use the she sound to help you find the muscle, but once you kind of get a sense of where the muscle is, you still want to practice to do the abdominal bracing with the muscle itself. So we're going to try the abdominal bracing again. You find your two bones. You're going to gently draw in the line to bring the two bones closer together. Hold it for 10 seconds. Make sure you're not holding your breath. And you can do this exercise in sitting or standing position. So I'm going to show you sitting. So in sitting, make sure your feet's flat on the floor. You're sitting in a good alignment, not slouching, not leaning sideways. And nobody should know that you're doing this exercise as well when you're in sitting in front of the dining table. So, same idea. If you're having a hard time, you can just place your hand right there. Imagine a line between the two bones right here. You're going to gently draw in a line. You might be able to see my hand get pulled inward a little bit right there. As you're holding the contraction, make sure you're still breathing. And then you're letting it go. And that is the transverse abdominis. Hopefully you have given this a try and felt a difference. Check with your healthcare professional to make sure this is right for you. I'm Dr. Yvonne Huang, and thanks for tuning in.